as Rima said, I'm Evelyn Guerra, and I coordinate interpreter services here at SCCA. So I work directly with the Academy of Languages on the SCCA side of things to confirm interpreters for our patients here. So I'm just going to do really quickly an overview of the SCCA for you. And some of this may be stuff that you already know if you've already taken assignments here, but we'll go over it very quickly. So the SCCA is Seattle Cancer Care Alliance. We are an alliance, and our partners include the Fred Hutch, which is the research arm of the alliance. We have Seattle Children's is the take our pediatric cancer patients, which are primarily transplant patients, and UW Medicine, which they see our inpatient when patients have to be hospitalized. They go to the UW. So this is just a quick history. You can see the timeline of the SCCA. This clinic that you take assignments at over here, we started that opened in 2001. So in 2011, we actually celebrated our 10-year anniversary. The SCCA officially started long before that. You can see in 1997, it was the public announcement of the SCCA's formation. So yeah, we've been now 17 years, 18 years. So we're getting close to celebrating our 20. And you can see at the end of the timeline, we recently, and there's another slide that shows this a little bit more closely, but we do have clinics at Evergreen and at Northwest as well. So I know that sometimes some of you do take assignments at those clinics. But this is our main clinic. This is the majority of our appointments happen here at the Eastlake Clinic. So our purpose is to provide state-of-the-art patient and family-centered care and support the conduct of cancer clinical research and education, enhance access to improved cancer interventions, and advance the standard of care regionally and beyond. And our vision is to lead the world in translating scientific discovery into prevention, diagnosis, treatment, and cure of cancer. So this is the slide I was talking about that shows you a little bit of our alliance partners, but in addition, our satellite clinics at Evergreen and Northwest. So as you can see, the UWMC, that's where our inpatient beds, so 116 inpatient beds, 20 of those are for SCCA patients. And there are some outpatient oncology services there as well. Our pediatric transplantations are seen at the Seattle Children's Hospital. We do have medical oncology, infusion, and radiation oncology at Northwest, which is near Northgate, and then the Evergreen Health Clinic in Kirkland sees medical oncology and infusion patients. So just a breakdown of what we do on each floor here at the main clinic at the South Lake Union. So first floor, you've got patient registration, you've got the lab, our radiation oncology department. Second floor is where radiology, all MRI, CAT scans, all of that take place on the second floor. Procedure suite, which is typically where patients have their ports put in, taken out, that kind of thing. The third, fourth, and sixth floors are all clinics, and there's a slide that breaks down what clinics are on each floor. Fifth floor is infusion, primarily infusion, apheresis, and the pharmacies on the fifth floor as well. So the third and the fourth floors are the Women's Center and Specialty Oncology clinics. And then the fourth floor is our general oncology clinics. And this lists out for you all of the different types of oncology patients that we see on those floors. Yeah. And then our preventive and supportive care services, these are kind of, so you'll find sometimes that you won't know always where the patients for these clinics will be seen because they're not on a dedicated floor. And so the scheduler schedule them based on availability on a floor. So they might be seen on the third floor, they might be seen on the fourth floor. And then our clinical trials and research, as I said, the Fred Hutch is one of our alliance partners, and their work is in clinical research or cancer research. And so a lot of our patients participate in clinical trials when they're here. And then some of the providers and staff at the SCCA, this lists everybody that you will probably work with at some point as you take assignments here at the SCCA. I particularly like this slide and think it's important for us as interpreters to familiarize ourselves with all of these different staff and providers, because there are so many of them, and sometimes in each of our languages there isn't a direct translation for who these people are, right? And you'll find also, especially with our research, our clinical trials, research appointments, that sometimes it's, researchers and fellows, and in transplant, patients see multiple providers because providers rotate through their care. And so they may have like one primary doctor, but then there's a couple of different fellows that come and see them. And there's a couple of different, I can't even remember the titles of some of the folks that see our patients in transplant. So just something to be aware of as you're working with patients. If there isn't a direct translation, maybe a description of what that person's position is at the SCCA, just so that you're not saying, this is Dr. So-and-so every time, because they're not all doctors. So, so the kind of treatments oncology and hematology patients receive, we've talked chemotherapy, that happens in infusion on the 5th floor, radiation therapy, which happens on the 1st floor, biotherapy, biological response modifiers, and immunotherapy. I think those are closely related. We do have a presenter who's going to talk about immunotherapy and transplant, so she can give you more information on that. Hormone therapy, surgery, or any combination of the above are the types of treatments that patients are getting here. Oh, that was fast. I went through that pretty quickly. Okay, so that was it. Any questions? Yeah.
Well, it's not a question. It's just like something that helps you a lot navigating the system with the SCCA in the building. Let's say you are provided with a U number. So when you actually reach to the registration person, in many of the registration people don't like to actually go into direct U numbers. Yeah. But since schedule changed so fast and some of the patients have to go to different floors and it's difficult to follow that, the U number will always get you to the patient in the right place. Yes, that is a really helpful tip, because if you go to any of the patient service representatives who are the front desk people on each floor, and if you have the patient's U number, that's the easiest way for them to look up and find, where, if the patient, if their schedule changed or if they haven't checked in yet, the easiest thing is to provide them with the U number. Yeah.
Is that a medical record number?
It is. It's the medical record number. It's just in our clinic, it starts with the U. Yeah. Okay. Any other questions?
Where would the proton therapy?
That's a good question. Proton therapy happens at the Northwest clinic. That's where it's based. And actually, we don't provide interpreters for the proton therapy clinic because they're kind of their own thing, even though we SCCA partners with them. But so we actually don't provide interpreter for proton therapy. Yes, Patty? Okay, thank you very much.